So if you take a look to this young lady, and if you take a look to this lady, and definitely it's the daughter and the mother, you can predict your patient how she will look like in the next years. And what we can see, of course, it's multifunctional aging. It's a reduction of the fat pads of the zoof. We have reduced elasticity. You see, even the younger patient, she has a certain disposition for these brownish spots. But what we can see is that we really have, or this lady had a very extensive muscle activity in her life. And this is a target where we want to use botulinumtoxinA. And if I speak about this region, there are plenty of different injection sites possible. And in my actual presentation, I will speak more about the lower parts. And in the afternoon, if we speak about the difficult forehead, I speak about the other injection points. But as you all know, anatomy, not only for filler, also for the toxins. And you have heard a lot about this. But what is important to know is that we really have a group working together. We have muscles, you know this, with a caudal contraction, the depressors, and we have only one muscle who's lifting up the frontalis, and the upper part of the musculus orbicularis oculi pars orbitalis. And these muscles, they build a perfect system. And if we use botulinumtoxin, we interfere with this system. We have to be aware of this. And our job is, if you weaken one of these men who towing the rope, the other one will be the winner. And we have to be aware. And the idea of treatment is simple. We have to change the balance the way we want. And if we understand this, we understand a lot about the treatment with botulinumtoxinA. So most of the patients who come to me at the office, they complain about the typical crow's feet, the lateral part of the orbicularis oculi. But they also complain about the infraorbital part and, of course, about the part just above the os zygomaticus. And we have to treat these patients. And if we treat crow's feet, we know all very well it's a perfect indication. And what we know is that all products work very well. This is a study from Wolf Prager from Germany. He compared botulinumtoxin with botulinumtoxin, and there were no difference in 2010. So they are really excellent results. And in Germany, we just we got the approval of incobotulinumtoxin for the treatment of canthal lines. The data are not published so far, so it's the second product at the moment with the approval for the lateral canthal lines. And you see the study design. I don't want to speak about the study design in detail, but you can see that 111 patients were involved and 12 units Bocuture or placebo was injected in a 3-point or 4-point schedule. Inclusion criteria, typical moderate to severe lateral canthal lines. And from all study, we know the response, at least an improvement of 1 point at a 4-point scale. Here you can see the typical injection points. That's the scheme, how they inject it. And this is the result. What you can see, you see definitely after 30 days that there is an improvement if you compare Bocuture, that's the name in Germany for incobotulinumtoxin, like probably you all know, but that's a German name. And you see definitely an improvement. So I don't have any more data. I'm not involved in this study. It's not published. In Italy, as far as I'm informed, incobotulinumtoxinA will get the approval at the beginning of next year. Other countries, UK for example, they already have the approval. So, but I was definitely involved into the German guidelines. Maurizio, Porter Boris and myself, we initiated and we published a guideline, official guideline, and in this case you can make a photo because here you see the English version, and this was definitely independent on the industry. So we I was asked by the German Society of Dermatology and the German Society of Dermatologic Surgery to create a guideline on scientific basic. And this was not an easy job, but finally we could make it. And when we read these guidelines, the guidelines say take care of everything. Date of onset, longevity, the question of antibodies. It's not the topic today to speak about this, but there you can find everything on English. So, and the guidelines, they recommend to inject 1 to 3 units, and we have to speak of the different units, Allergan units, Merz units, and Galderma units, and we have an equipotency of 1 to 1 to Allergan and Merz, and an equipotency of about 1 to 2.5 to IncobotulinumtoxinA. And that's also the official recommendation of an international group, a consensus education initiative group. But if we follow this recommendation, you will get this result. Are we happy with this result? No. Why? That's what we were speaking about before. And this is not what we want to reach. We want to create very smooth transition if we treat crow's feet. So let's come back to this picture. You know this before. And this is the result before and afterwards. So you can see a tremendous improvement for the typical crow's feet, for the infraorbital part, and for the part around the os sigmaticus. Pictures not from the patient, the rest is possible. So how can we get this excellent results? How can we get it? And we have heard about today about the word or term mesobotox. So I would really like to speak about the microinjection technique. And what is a microinjection technique? That's a technique where we want to target the very, very superficial muscles inserting at the dermis. Here you can see the epidermis, you see the dermis, sebaceous glands, and here you can find the muscles. And the idea of microinjection technique is to inject extremely superficial, a very highly diluted amount of low concentrated botulinumtoxinA. That's the idea. We don't want to relax the whole muscle. We want to take out the tension of the skin. That's the idea behind this technique. And to understand how I do it, this is an example. For example, 50 units Bocuture reconstituted with 1.25 ml saline. And if you take a 1 ml syringe and one line is 1 unit botulinumtoxin, 1 unit Bocuture, and if you add 5 units saline in the syringe, it's simple. We don't have to play with the reconstitution, we can play in the syringe because the spreading with saline and botulinumtoxin, that's very, it's a homogeneous fluid. And of course, one line is now 0.37 units. And look to the result, if we inject into the classical points and we add additionally to the infraorbital part and to the area around the os sigmaticus, this microinjection technique, we can reach excellent results. We have to be careful in the os sigmaticus area. That's why we don't want to really inject with high concentrated botulinumtoxin, because we know the higher concentration, the more spreading we have. And we don't want to get a spreading. Why in this area? We've heard about it. We don't want to target the os sigmaticus, the sigmaticus minor and sigmaticus major. We have to be aware. Otherwise, we produce a depression of the midface, a depression of the corner of the mouth. That's something we have to avoid. But do we have any scientific data so far about microinjection technique? No. That's why I had the idea just to initiate really a pilot study. It's not a big study, but the study design was absolutely okay. And my idea was to investigate the efficacy and the safety of additional microtoplet technique to the conventional injection for the treatment of crow's feet with IncoA. That was my idea. And Here is a study design, and now you will laugh, only 4 patients, that's no statistical significance. I know this, but this was just an idea. But the study design was typical maximum expression at the Merz scale. You have heard about today about the Merz scale, severity score 3 to 4. And typical exclusion criteria, you know this, I don't have to speak about this, no toxins the last 6 months. And the time of investigation was after 4 weeks and after 12 weeks. So the efficacy parameter, you can read it. Typically, the evaluation, the investigators and the subjects has to evaluate the degree of the improvement. Primary endpoint was defined. And we want to take a look to safety and tolerability. So the treatment, classical standard treatment, 4 units for each point of one side, plus 6 additional micro injections of IncoA on the left side, and on the right side an equal quantity of saline. It's easier to understand if you see the treatment plan. Now you can see it. 4 units Inco, Bocuture, 0.5 units diluted on the left side, and on the right side saline, to see if there's a difference. And the result was that we really could see a greater improve on the side of the face treated with additional microdroplet technique with IncoA. And one thing is important. One patient didn't respond to this treatment. She was 65. Do you know why? Because the elasticity was too reduced. I told you the idea behind this technique is to take the tension out of the skin. If the elasticity is too low, this technique does definitely not work. So I use this technique especially in younger patients. So all women preferred the result on the left side. Treatment was well tolerated, and no adverse events were reported. So conclusion is that the addition of this microdroplet technique to the standard technique is a promising procedure for the treatment of crow's feet. It is safe and well tolerated. And also I know that's absolutely limited, but it provides insight into the potential for this technique, and it should serve as a stimulus for larger studies. That was the idea behind. And if we take a look, now to one of the patients, you can see before treatment the left side and the right side. After 4 weeks, you see the result, very smooth transition, and here you still see the result we don't like. And even after 12 weeks, we can still see an improvement. It's coming back. And always is a question, if we use microdroplet technique, how long does it last? And I always tell my patient, probably it will not last as long as the classical injection, but these data are worth to discuss about. So microdroplet technique works also absolutely in the infraorbital part. As you can see here, we can really get very good results. Look at this patient, younger patient again, before treatment, after treatment. We can really see there's no filler. It was not my job to speak today about the combination with filler in the periorbital area, just about the simple botulinumtoxin, and we see these results. Excellent. And that's the patient after 2 weeks. Relaxed. And at contraction, maximum contraction before and afterwards. So, these are the points. I am always careful. I never inject more than 2 or 3 units in the infraorbital area. Be careful. Why? Or better, I have to ask you, do I treat all patients in the infraorbital area? Would I treat this patient? What do you think? Definitely not. You always have to do before a pinch test. You can always read a snap test. A snap test is different. It's a retraction of the tarsus. That's why I call this test pinch test. And we want to see what happens with the skin. If the skin stays erected for more than 1 second, we have a positive pinch test. And please don't treat these patients. Why? Here you can see what happens. Sorry, I'm too fast. So there's the pinch test. So here's the pinch test, positive. So it's a no-go. Why? Look at this patient. I like to speak about complications. That's my favorite. You don't learn, even as a physician, if you don't have produced any complications, believe me. And look at this patient. She was treated with a microinjection technique, and this was the result afterwards. She complained about the situation now. And absolutely, this was not a patient to treat with technique, because we take the tension, there's just a little bit tension less, and we take it away. So this is the result we don't like. So, look at this patient. Treatment infraorbital. 6 units totally, 3 units each side. And we see the next complication. What happens? We have an edema. And this is really a problem if we inject with this technique. So patient selection is so important. And look at this patient before. Do you know, can you see this area? And if you ask the patient, when you wake up, do you have swelling of your lower eyelid? And she tells you, yes, sometimes. Don't treat them. Because we take away the muscle activity and the pressure to the lymph vessels. Be really careful. So, I hope I'm in time, I'm even a little bit faster. But my idea is, and we will speak in the afternoon about the balance. If we discuss about the forehead, don't lose the balance. Believe what you are doing. If you weaken one muscle, the other group will be the winner. Thank you for your attention. Mille grazie.